everyone, welcome to the channel. Thank you so much for tuning in again. So I have a patient that I saw on hospice. Well, I never saw the patient on hospice. I saw the patient as a regular patient in the practice, and I referred out to hospice care because I think that patient would benefit so much from being on hospice. And it turned out that that patient got denied because, he didn't have Medicaid insurance. And this is not the first time I'm seeing it. It's not the second time, third time, but I just wanted to highlight it a little bit because it is very sad, especially when you look at, our population that we're serving, the elderly population. It is just a sad situation because they are not really getting the care that we really want them to get, given the fact that they don't have the necessary insurance. And if you don't have insurance, no service, basically your health is just like, going down. So he was supposed to go on hospice. He has like a bunch of underlying problems that he would benefit from, and there is so much things that we can't really do for him. I'm not going to list out all of his medical diagnosis, but he would have benefited from hospice service. And because he doesn't have the Medicaid insurance, he's not able to get onto hospice. He's not able to get a wheelchair. He had amputation done. He's not able to get anything done. Certain medications he's not able to get because he doesn't have the supplemental insurance to cover for that. And so it's like you're seeing the patients and you're doing all of these work, you're ordering all of these testing, you're ordering the medications, you're ordering physiotherapy, you're ordering everything that you can because you think the patient will benefit from it, and then only to find out that every single thing that you order gets denied because there is no insurance to cover for it. And it's just a sad situation because if there's no insurance to cover it, this gentleman who is living with somebody else who is on the service that we're seeing, and he is also wheelchair bound. The gentleman that we put on hospice, he was a little bit more ambulatory in a sense, but then, he was just kind of going downhill in terms of his prognosis and what was happening with him. And so now he is actually bedridden. So can you imagine you have one person who is relying on a wheelchair, a motor wheelchair, and you have another person who was helping out that person who is in a wheelchair now being bedridden because he is not able to get the necessary supplies, or he is now amputated and not really able to do anything. You go into a home now and you see that nothing you ordered is getting done for the patient. The patient can't get this, the patient can't get that because there is no medical, there is no the insurance is not there to help with the patient. And so it's just a sad situation. I don't know, but I just wanted to kind of talk about it because if you're thinking about coming into the practice, or not necessarily my practice, but in the practice of house call visits, you're gonna realize that there's so much you can do for these patients, but at the end of the day, the amount of things that you do, it's a small amount of it that gets implemented. Doing the house call visits, yes, it is good. You see where the patients are lacking, and you wanting to help. You do the referrals, you do your orders, you order your physiotherapy, you order everything under the sun. And then when you look, the patient can't benefit from anything because the patient doesn't have the necessary insurance. The patient don't have Medicaid. And it's just a sad situation. It's just very sad. And I just wanted to touch on that because this is not the first time, the second time I'm actually seeing or I'm referring a patient to hospice, and I realize that the patient can't get onto hospice because they don't have the necessary insurance to cover for it. And it's just, I don't know. It's like we're seeing a patient, but at the end of the day, I feel as though we're not doing much for them because we see them, we order their basic labs, we order their medications, and we do the referrals. And then at the end of the day, it's like, they're just at the same place where we met them initially. So I don't know if there's going to be any change in terms of how, the Medicaid is going to come in and help with some of these patients because them really need it, Them really need a Medicaid, they really need the insurance, but I don't know what to tell the patients. I literally don't know what to tell the patients. They say, oh, I can't get a wheelchair, they can't get any incontinent pads, they can't get diapers, they can't get any glucose monitor, they can't get this. They call the pharmacy, oh, the insurance is not active. You call the home health service, oh, we can't see them because there's no money, or it's always something to do with the insurance. So people, if you're watching this and you're not in the health field, I'm just encouraging everybody to make sure you have your insurance, because insurance is a big deal. If you don't have insurance, it's gonna mess you up. It's gonna really mess you up in the long run. So it's just an unfortunate situation that we find ourselves in, especially for elderly folks who are relying so heavily on this, and you don't really understand it until you're in the situation where you really need something, and that just only worsens the situation where you become depressed, you become, you know, anxious, you just feeling, you know, having different thoughts and all that complicate your situation. So I don't know, but I just wanted to share this with you because this is just something that I constantly see on a regular basis, where you do all of these referrals but you hear that, oh, we can't do this because there is no Medicaid. So whatever we can do, try and find out from early, you know, what you need to do, put in place so you can actually get your Medicaid insurance up and running, or your Medicaid coverage up and running. So by the time you reach a stage where you're an elderly and you're in a service where, you know, you're in need of certain things, then your insurance will go ahead and cover it because you have your Medicaid insurance. All right.